Good afternoon. Before the Premier and Marion and I start giving our COVID-19 update, there's another public health issue which I need to speak about briefly. Today, our office is alerting islanders as part of a public health alert of the presence of a highly potent opioid, fentanyl, in the province of Prince Edward Island. Fentanyl is a powerful opioid known to be 50 to 100 times stronger than morphine and has caused accidental overdoses and death in individuals who consume street drugs. And I know the Department of Justice and Public Safety has worked with police and is working with police to reduce illegal drugs in this province. But we want islanders today to understand the serious risks that they are taking when they choose to use street drugs. And we are asking anyone who is going to consume street drugs, not only opioids, but any drug in pill or powdered form, to take steps to reduce the risks, including carrying naloxone and informing others who may use drugs that naloxone is available. We have been in touch with the RCMP, EMO, and Justice, and community organizations, and have just also notified our Opiate Action Plan Implementation Committee. And we'll be reminding providers this afternoon that if they see an overdose in the province, to make sure they test for fentanyl. This public health alert comes, and we've had to do this before, that if we see a cluster of overdoses, and that is not overdoses necessarily resulting in death, but overdoses, that it triggers us to issue this kind of alert. Just to note, the action plan to mitigate the use and misuse of opioids was released a couple of years ago, and after that we have been doing ongoing surveillance regarding our overdoses and our overdoses resulting in deaths. So I will leave that for now and then turn it over to you, Premier.
Well, thank you, Heather, and I think a scary and real reminder that everyday life is ongoing in PEI and that we need to pay attention to, even as we dedicate so much of our time and effort into COVID-19. So I just wanted to say that Heather and Marion will provide their regular briefing in a moment. I thought going into the weekend that we should do a quick recap of what happened this week and to talk about the progress that we continue to make as a province as we ease our way back. This week we announced a number of things, beginning with the much-needed increase in funding for private operated long-term care and community care facilities. We know that looking to our sister provinces, this population needs our support to make sure every possible effort is being undertaken to prevent an outbreak. We were pleased to work with the long-term care and community care associations to come up with a plan that will provide further protections also for PPE and to assist with their staffing resources. Yesterday, it was announced that the essential worker top-up will provide a $1,000 one-time payment to those essential workers who have worked hard and provided exemplary service, and will continue to do so during this difficult time. This is much needed money that will get into their hands quickly, and I just wanted to thank all of those on behalf of Islanders for their tireless and important effort. We also announced significant supports for our lobster harvesting sector. We know there is a great uncertainty around this primary sector, one of the key economic drivers of the PEI economy. The program is twofold. First, knowing that there is potential for a significant drop in fish-related revenues this year, we are offering fishers the option to defer loan payments and interest for a year for those fishers who are financed through Finance PEI. For those who are financed through private lenders, we will offer the option to pay their interest for up to 12 months, and we have asked those private lenders also to defer payments for 12 months if it's required. Secondly, we are offering a new emergency loan facility of up to $25,000 on a no interest, no payment for up to 18 months basis. This is to ensure that our fishers would have adequate working capital to help employ their corks, to help with equipment, etc. Very important program for a very important sector. Our adaptation fund as well, we announced for equipping businesses to reopen. This is designed to provide some support to businesses and organizations for expenditures to become more COVID safe. Expenditures such as plexiglass, hand washing stations, gloves and masks, etc. And this program was announced that we will cover up to 75% of a cost up to amount of $2,000. So again, responding to the requests and needs of those who are trying to adjust in this difficult time. On the First Minister's call last night with the Prime Minister and Premiers, I continued to advocate for flexibility around the Canadian Emergency Wage Subsidy Program to better assist our business community, in particular our primary sectors like tourism, as well as the service sector. As this program was initially rolled out, a very important, significant program that was much needed, there were also some timing constraints that made it difficult for many of our core businesses to fully access. And repeatedly, week after week, I've been asking the Prime Minister to extend the program and to allow it to be more flexible so that it can be used for its intended use. I'm told today that the Prime Minister made an announcement at his own press briefing with more details to come. I'm excited to chat with officials in the Prime Minister's office later today to learn more of these details. But I would say that on behalf of all Islanders that I am so very grateful that Prime Minister Trudeau, Deputy Prime Minister Freeland, and Provincial Responsibility Minister Lawrence Macaulay, who have been, among others, among the other MPs as well, who have been so open and helpful to tailor programs to help Islanders. So more details to follow, but that is a very encouraging piece of news that we learned moments ago. Sunday, as we know, is Mother's Day, so let's remember to be grateful for all of those in our lives who are so important and helped us get to where we are today. With that in mind, because of the hard work of Islanders, and specifically given the negative test results that we have seen in the last 3 weeks, I am pleased to announce that we are in a position to move a little bit more quickly with continued caution with our Renew PEI Together plan. Heather will announce some of these details in a moment. But when we first rolled out this plan, we knew it would need to be reviewed daily and updated, particularly as we learn more about COVID and as we reflect on our current situation as a province. As I said, Dr. Morrison will announce some of these changes in a moment. I can think of no better time to have a bit greater flexibility to interact with family and friends than this weekend. But I also would say that it is important to remember that we are in this situation because Islanders have been responsible, we have held each other accountable, and we will need that to continue as we continue on the plan of our ease back. And as I say, more details to follow here in a moment. Also, just in closing, it's important to recognize that understanding that this weekend traditionally represents a change of season. Normally, we would be seeing university convocations and the opening of lobster season, and of course, the many family gatherings celebrating our mothers and the important mother figures in our lives. While the restrictions being amended today will be nice and make it a little bit easier, we do realize it is of limited solace to so many who have had their plans turned upside down. We need to continue to focus on how well we have done to help us get this far. And if we continue to follow the guidance of the Chief Public Health Office and the Chief Public Health Officer, we have the opportunity to expand our ability to socialize and share more with our family and friends as we move forward and learn to live with COVID. So I thank Islanders for their patience and for making this happen. And just again in closing, I would again remind everyone to take the time this weekend to appreciate their mothers, as well as the mother figures in their lives. The support and strength that they have provided not just to your families, but to our extended families. And as we know, they are the backbones of our communities, large and small, here in PEI. And just on a personal note, I would say thank you and wish a happy Mother's Day to both Heather and Marion, and thanking them for their tireless work, but also to say thank you to their families, their children, for sharing these two leaders with us and all of PEI for the last few months. It's been an incredible undertaking, and on behalf of everybody, I thank both of you. So with that, Heather, I'll turn it over to you.
Thank you, Premier. Good afternoon again. So I have good news today. We can now say that 27 of our 27 cases of COVID-19 are recovered. And we are in such a fortunate position here in PI. We have all worked so hard to be able to say that we have had only 27 cases, and now all are recovered. We've not had any hospitalizations, no deaths. We are very fortunate. But across the world, we watch and see almost 3.9 million cases of COVID-19. In the country, here in Canada, there are more than 4,400 deaths. So the global pandemic continues. As the Premier mentioned, this Renew PI plan, Together plan, was developed really almost 2 to 3 weeks ago, and we remain committed to reevaluating it and updating it, as the Premier mentioned. And really the first of those updates will happen today. As I mentioned, our last case is recovered and off self-isolation, and we have no evidence of active COVID-19 infection in PI and no evidence of widespread community transmission. Since the last briefing, we have had 199 new negative tests and have tested almost 3,800 people. We continue to test broadly, and those even with the mildest of symptoms and those who are at risk, who have traveled outside the province, we continue to test. Our borders certainly have restrictions in place. But we know people have been struggling, and we hear their stories every day. And part of our monitoring and evaluation is to look at unintended impacts of public health action. We know there are psychological and social impacts for so many, along, of course, with the economic impacts. So while our borders remain tight, it is our opportunity to protect, to take some additional measures so that we can, but do so cautiously and thoughtfully. So as we lead into this Mother's Day weekend, members of the same household can gather indoors with up to 5 other individuals. For instance, my family could actually have my sister, her husband, and my mother over to celebrate Mother's Day. With this, it's important that we continue to maintain physical distancing as much as possible. We know that limiting our close interactions with others is one of our best defenses against COVID-19, but we also know that there are people who are feeling isolated and who have loved ones in need. So the other part of the update today is that you may consider extending your household to reconnect with a loved one or support person. There may be someone outside your immediate household you may need to hug or who may really need a hug. In doing so, everyone should consider the risks. It's important we continue to protect our household, our supports, and loved ones if you choose to extend your household members. So keep it exclusive. And this means by being very careful in extending your household to people who may not be significantly immunocompromised, and anyone who's traveled in the past 2 weeks needs to still stay in self-isolation. And of course, making sure people are not sick or feeling unwell. Measures that have not changed and that will continue to be important as we move forward are staying home when you're sick, continuing to practice physical distancing, washing our hands, covering our cough, and if you've traveled out of the province, of course, self-isolating for 14 days. As we begin to interact more in the days and weeks to come, please consider keeping a log, and we've mentioned it before, keeping a log of the people you've had contact with. And this will help us tremendously in our efforts to do contact tracing for new cases, and will also serve as a gentle personal reminder to limit close interactions with too many. These changes to Renew PEI Together mean we will also be updating a guidance around for funeral homes and recognizing the really critical process of grieving that's so important for all of us. And for those affected, being affected by visitor restrictions in place at long-term care homes, and I've mentioned this before, we are actively looking at options of how we reconnect loved ones and family with residents, but this will be in consultation with long-term care facilities as we go forward. Also to note that in consultation with the Restaurant Association and other operators, we're looking at a potential earlier date for restaurants to open, and discussions will continue and over the days ahead. We will continue to look at this plan, and a new updated version will be available of the plan on the weekend, and we can talk more about what phase 2 will look like next week. We know that there continue to be a lot of questions about essential travel to our province. And to help those wondering if they can travel to PEI, a new self-assessment tool will help determine if their travel needs a pre-approval. And it is available on the Renew PEI webpage under the travel restrictions section. And anyone using that tool can find out quickly if they need to apply for pre-approval. And if you do, please check the pre-approval travel page to find out what you need for identification and documents you'll need. And I've been reminded to just let people know that the best way to get in touch with EMO, the Emergency Measures Organization, who's handling the pre-approval process, is by email at publicsafety@gov.pe.ca, and there's a new phone number, 902-368-5025, and we hope this new tool will answer some questions. I'm almost through. We've had several questions regarding the Magdalen Island ferry. Any individuals arriving to PEI via this ferry are not permitted to stay in Prince Edward Island. And so far this month, there are no visitors that have arrived off the ferry from the Magdalen Islands. We do have essential workers traveling through. In the other directions, individuals who are leaving from their province of Quebec to get to their home in the Magdalen Islands do have permission to do so, and they often have a letter of permission. A total of 15 vehicles so far this month have traveled through PEI. And it is similar to an islander who may be in Nova Scotia who needs to get home to Prince Edward Island. They need to travel through New Brunswick to get there. So finally, Islanders have done a wonderful job following the measures we put in place, and the Premier's mentioned that. And really, we've avoided having a curve because of this. And now we're at a point where we can actually gather a little bit more, although keeping physical distancing and limiting those numbers. And although we've found different ways to connect, there's just no virtual replacement for some of that human connection. So it's very fitting that we'll get to gather and celebrate all the wonderful mothers and, as you mentioned, Premier, mother figures in our lives for Mother's Day. And whether you're a mother who has continued working or stayed home, Like everyone, we've adapted quickly to a new way of doing things, and many have become teachers and have answered difficult questions and eased fears in a time of uncertainty. I know it has not been easy, but the difficult steps we have taken have put us in a better place today. I have said this before, the best way to come together is to stay apart, and now we can come together a little bit more. So thank you all. Thank you to my mother. And as we get frustrated and anxious and challenged as we move forward, please let us proceed cautiously, but with care and caring for each other. Thank you. Maybe I'll just go to Marianne.
Sure. Take a break.
Yeah. Thank you. Good afternoon, everyone. Our focus at Health PEI continues to be on monitoring and planning for any cases of COVID-19 and possible spread. In particular, we're very carefully planning for long-term care homes to help ensure our most vulnerable islanders on PEI are protected. We also continue to monitor the health services that are delivered. And while Health PEI is providing more services, such as some elective surgeries now, we are carefully watching how this impacts our capability in hospitals, which we will need in order to be prepared if there were to be an outbreak. We know that as a small province, while we've managed so far to keep our numbers low, and thankfully now to zero, and having no patients in hospital, it can change very quickly, as we have seen. COVID-19 is still very active in provinces in Eastern Canada, and we must be prepared for these cases to come here and strive to limit the spread if it does come. Moving forward, a team has been set up to help manage the reinstatement of additional Health PEI services in a balanced and careful way. The team will consider the needs of patients and weigh any risks of reintroducing services against the risks of continuing to delay them. The team will also look closely at the innovative practices and new services that have been created, like virtual care or psychiatric urgent care or cough and fever clinics that could be a part of our healthcare system in an ongoing way. We know that this approach will take time, and we ask for your patience as we continue to be prepared to maintain our capacity over the coming weeks and months. A reminder that our hospitals and healthcare facilities are safe, and if you need care, please come to each facility as they have protocols put in place by our infection prevention and control teams to ensure your safety. Safety is a priority, and we want all patients to feel safe when they have to come to a health center or hospital. It's important to take care of your health needs before they become bigger issues. If you are sick and have a health concern, please contact your family doctor or nurse practitioner's office or go to a walk-in clinic. A list of walk-in clinics and times can be found on the Health PEI website. Call 911 or go to an emergency department if you have a healthcare emergency. I want to speak a little bit about our mental health supports, which are available, and addiction supports in the province as well. And also, I'm very pleased to report that there's a new service available for children and youth in this province who need mental health support. A child and youth urgent mental health care service is now available for children and youth under the age of 18 with urgent and acute mental health needs. For the child and youth mental health clinic, we have a number, and I will say it twice. It's 1-866-833-5443. So the number is 1-866-833-5443. And the hours of this clinic are from 12 p.m. to 6 p.m. daily. Trained mental health clinicians and Health PEI staff will provide a thorough risk assessment, some stabilization and connection to local community supports to the children and youth population. The clinic is there to provide care for children and youth who need urgent mental health care away from the emergency department, and it will be offered as a virtual clinic. Services are being delivered via call-in and video conferencing between the child, parent or guardian, and the mental health clinician. Clinical psychologists, crisis nurses, social workers are available as part of a multidisciplinary team supporting the child and youth urgent mental health care service. Psychiatrists are available on call and via telehealth as required as well. Those individuals who require emergency medical stabilization for mental health issues will still be seen at emergency departments as usual. But individuals with non-urgent mental health and addiction cases can continue to be served with the available ongoing supports with community mental health, the student well-being teams, Strongest Families, and our other community partners. As a reminder as well, adults who need access to mental health and addictions information service can access that through the COVID response line, and that is the number here in front of me, but it's 1-833-533-9333. And calls are answered on that line as well by trained mental health and addiction staff from 8 to 4, Monday to Friday. Individuals who require acute mental health admission will be directed to our other psychiatric urgent care clinics for adults that are located at Hillsborough Hospital and now at the Prince County Hospital as well. And those hours are from 9 a.m. till 7 p.m. every day. All individuals who require emergency medical stabilization will be seen in emergency departments. A little bit of information, our cough and fever clinics and the drive-through testing clinic services, which continue in Charlottetown and Summerside 7 days a week. Yesterday, we saw 88 patients at our Charlottetown clinic and 23 at Summerside. If you have symptoms such as a new cough, fever, sore throat, runny nose, or unexplained fatigue, please contact your family doctor or nurse practitioner or call 811 to get an appointment at the clinic. I want to just thank Islanders once again who have been helping and supporting our health system in this response through following the Chief Public Health Office measures. It really has supported our health system and our staff and has given us time to be even better prepared to deal with this specific virus and what is bringing to the people of our country and in particular our province. I'm pleased to hear about new opening of some of the measures that we can have today to socialize, and wish everyone a good weekend and enjoy Mother's Day. Thank you.
Well, thank you very much, Marion and Heather, and I think now we will turn to our friends in the media for some questions and would welcome those.
Nicole Williams, CBC.
Hello, everyone. My questions are for Dr. Morrison. I'm wondering if you could just be a little more specific about the ability for physical touch this weekend. I think people are very excited to hear this news, and I think if there's any more clarification or any more specifics you can tell us about what is allowed, that would be great.
Nicole, I think I share in some of that I don't know, the excitement as well. I mean, we already have that ability to connect more physically with our families in our own household. So if you have children, of course, you're putting them to bed and you're hugging them and kissing them goodnight. What we're trying to introduce carefully is that maybe there's one or two other people that you feel like you really want to extend, almost make your family a little bit bigger. And that really, you will have a bit of that physical connection with. And sometimes it is easier to use examples. So for instance, my sister could be over at the house and be able to hug my children if that's who I want to keep, keep close. And So she's an important support for our family, for instance, and that would be one example. It may be grandparents who really will become part of that of your household. It's almost increasing your household unit, but doing so carefully and limited. It's not deciding that you're going to be hugging everybody of the neighbors that you have, having them all over and giving them all hugs and kisses when you get over. It is about people who you will have an ongoing support role in connection with, and I think it's important for everyone. And then with everybody else, certainly we want to see other people and socialize to a certain degree, but trying to maintain physical distance with everybody else. We know from certainly across the country, you've probably seen this, Nicole, and we know that here, that if we go too quickly from what are normal, we're down to probably 30 to 40% of our normal contacts at this time. But if you increase that up to too quickly to 100% of what we used to have our contacts, we do put ourselves at risk of having a more widespread outbreak of COVID-19. So we want to increase that contacts, increase the number of contacts, but do so carefully without that percentage getting too high. And but we are also in a bit of a unique situation, and what we've seen over the last 2 or 3 weeks gives us some cautious optimism and a chance to move forward a little bit.
Thank you. And my second question, and you said this in the last briefing, and I know you said it again today, that we seem to have avoided the curve. Is it safe to say that we've reached the peak and that we're sort of officially on the other side?
I mean, I don't, you can really only tell that you've got over the peak when it's behind you, and really we don't have a big curve to look at. But I do think we're in a position to, not that we will not see COVID-19, and we continue to expect some COVID-19 here, and I think that's why we need to continue to test and continue to monitor. And then we'll look at what's happening around the country. There's an expectation that there may be a curve that happens, or more cases in the months to come. And I think we need to be aware of that, and again, continue to monitor, have the health system ready to respond. In our situation, if we had one significant outbreak, we could have well over 27 cases. So for now, I think we're really in a good position. And really, since early March, when we had our first case, we've waited to say on this day that we have all our cases have recovered, and we don't have any new cases to announce today.
Thanks so much.
You're welcome. Thanks, Nicole.
Louise Martin, CBC.
Well, boy, that was a bit of a roller coaster of emotions on this call today. So I'm going to start with what you first spoke about, Dr. Morrison, and that being the public health alert on fentanyl. Can you provide more specifics about the cluster that triggered this? How many overdoses? Have there been any deaths associated with this? And how concerned are you that there could be deaths associated with this fentanyl that's in the community right now?
Hi, Louise. So we monitor overdoses related to opiates on a weekly basis. But in this particular circumstance, we had 3 overdoses related to opioids and fentanyl in particular within a period of just over a day, and also in different parts of the province. And so that's what has triggered this alert, because we want anyone who may be using or consider using illicit drugs to be very careful. And we are having ongoing work, of course, with our police colleagues as well, and they are involved. For confidentiality reasons, obviously, I don't want to speak too much to the cases, but we know that fentanyl is very powerful, and we've had, in 2018, there was a death related to fentanyl, and a fentanyl overdose, or an overdose that had fentanyl involved in Prince Edward Island, and we are going to continue to monitor those. Those are not obviously confirmed. Of course, sometimes there's a lag because of autopsies, but we look at overdoses not because they necessarily cause death, but overdoses that required, for instance, Narcan or naloxone to be administered, and that came to hospital.
To make sure I'm getting that right, there were no deaths associated with this particular health alert.
There may or may not have been.
Okay.
And I'm just speaking to that overdoses related to fentanyl can cause deaths, and then or significant impacts. But at this point, and again, this is pretty new, Louise. So I just at this point, these are 3 overdoses that may or may not have resulted in death.
Okay, thank you.
Okay.
My second question is related to COVID-19, and that being tourist accommodation operators say they're finding it hard to plan without knowing if visitors from off-island will be allowed on the island at all this summer. I know we've talked sort of about that June 1st for people coming in for seasonal cottages as a potential date. So they want to be able to sort of release some of the rooms for this local staycation tourism season, but they can't until they know for certain whether any off-island tourists will be coming. Do you know, or do you have any sense of when the province might be able to provide more details on that?
Well, I mean, the Premier can speak to this as well, but I think it will be next week for sure. But my sense is that visitors who are coming for short periods of time this summer, probably this won't be the summer to come, but I'll let you speak to that, Premier.
Yeah, I think, Louise, essentially what we're looking at here is we wouldn't foresee right now an influx of people coming to the province without having to self-isolate for 14 days. So I think, Heather, that's probably the best way we could summarize it right now. So I think if maybe if the booking was summer long, I think maybe you might want to hold on to that a little bit longer. But I think if the booking was for 2 weeks or less for someone at a province, it's probably quite likely that they wouldn't be coming here because they would need to self-isolate while they're here. And you would probably ask the question if it was as lovely a place as it is, PEI, you probably don't want to come here to be cooped up in a room for 2 weeks and then have to go back home and do the same thing when you go home.
So that seems to indicate that the border could be relaxing some of the rules at some point, but the self-isolation rules would still be in place. Am I reading that right?
Now, Louise, that's 4 questions for you. I don't want to point out here, but I'm joking, of course. I'm joking. Look, I think we talk about this regularly. We do understand there's a lot of questions from the tourism industry, and there's a lot of questions from many industries, and it is frustrating for them as it is for us to not have a definitive answer. I think as it stands right now, we have talked about looking at New Brunswick down the road, but beyond that, we haven't really talked in great detail about how we would welcome visitors from other parts of the country or the continent without a self-isolation. But I think public health has been adamant that large gatherings and the self-isolation for travelers would be one of the last things to be lifted.
Thank you.
Rachel Collier, The Eastern Graphic.
Hi. My question today is for Dr. Morrison, and I'm wondering Can you talk more about expectations of the virus to arrive or spread on the island in waves in the future? I'm wondering, is it a relevant concern since we've not yet experienced community transmission and we have such specific measures in place for reducing travel to and from the island?
Hi, Rachel. So, I mean, I think we will continue, or we would expect to see some COVID-19 and possibly in future waves. It is very difficult to look ahead months from now. 4 months ago, we would never have anticipated that the whole country would be in this situation. I think we will be very anxious to look at when a vaccine would become available for our population here. And it will be really important that we keep some of these measures in place as we go into even an influenza season that might be combined with additional COVID-19 cases potentially in the fall. We're thinking ahead to that possibility. So the country certainly expects to potentially see more waves of this, but they might be smaller than our initial wave. And for us, I think we'll just really have to continue to be careful and monitor and test going forward and do a lot of the same things we've been doing, but try to balance that because we also need to make sure the other parts of our economy are working and our healthcare system, the other parts of the healthcare system. So how do we watch for any potential wave, minimize that in the future and have all the other things working?
Mm-hmm. And I guess, do you think it could be a realistic expectation to completely avoid community transmission of the virus on PEI should, say, a vaccine take, I mean, I've heard it might take years to develop?
I hope the vaccine doesn't take years to develop. I think there's a lot of people working on vaccine development and different phases of it. I, of course, would like to think we might avoid widespread community transmission. I'm not sure if that's possible, but I know Islanders have done an amazing job. The system's done an amazing job right across government, organizations, industries have responded so incredibly in the last couple of months, and I think we'll expect that will continue. And working together, I'm still hopeful that we'll have a minimal impact going forward. But I'm not 100% sure. That's for sure.
Okay. And do you have any better expectations for when a vaccine would arrive than my own there?
When the vaccine would be developed, I'm not sure when the vaccine, but we're certainly having ongoing discussions and watching that nationally because it would be an international of international interest, of course, and then making sure that vaccine would be available to all countries and the production of that vaccine would take time as well.
Okay, thanks a lot.
Sean McDougall, The Eastern Graphic.
Good afternoon, everyone. Dr. Morrison, I had a question about Phase 2 of the Renew PEI plan. For early childhood education centers, I'm just wondering why staff at these education centers won't be given access to proper PPE, such as masks, similar to those that are working in long-term healthcare centers.
I'm not sure if I'm the best person, Sean, to answer that question, but I think in terms of early childhood, they're certainly developing a plan and guidance. Our office is certainly working with them. I actually haven't even been, I don't think, asked directly about the requirements for PPE for early childhood. There's already essential workers or childhood care being provided for essential workers. We've had discussions with them about what would be appropriate personal protective equipment. And when we talk about personal protective equipment, there's quite a variety of what that would mean. And there's medical personal protective equipment, medical masks, there's non-medical masks, but there's a lot of things that can be done before you even consider personal protective equipment, and I think Marion spoke about that the other day. There's physical barriers, there's administrative type barriers, there's the screening that happens, making sure people who are sick don't come into the center. Much more important than the use of a medical or non-medical mask. So if those are the kinds of questions, so that would be sort of in conjunction with early childhood, and really the risk assessment being done about what would be appropriate. So I don't think it's ever been a situation where equipment is not being provided or would not be provided. It's about making sure that the right equipment is being used at the right time.
Okay, so just to follow up, has it been deemed whether or not something like masks would be necessary for early childhood educators?
I mean, I think you have to look at the situation. So if you're able to maintain physical distance, if you, which I know is difficult in those situations, you certainly can't have little children under 2 wearing a non-medical mask. So what does that look like for early childhood educators? But at this point in time, there's all sorts of screening before children get into the center. We do not have any evidence of community transmission here, so our advice today may be quite different than if we see widespread community transmission. And so that advice will change, and as it does, the direction for those centers would change.
Okay, thank you.
Judy,
And
Guardian.
Hi, good afternoon to everyone. I suppose my first question is for Dr. Morrison. I just want to be as specific as I can on the kind of contact rules right now, so forgive me if this looks a little silly to ask. But so what I'm understanding, correct me if I'm wrong, is as of this weekend, gatherings under 5 permitted. Some contact is okay. You can now hug or handshake, but try and keep the circle small. It's not quite like the bubble model, meaning you can maybe share more than with one other household. But generally, the rule is you can hug, shake hands, have contact within a domicile, not outside, but just try and generally keep it to a small group. Do I have that right?
Sort of. So it's members. So this is members of the same household can gather indoors with up to 5 other individuals. And so that is that, and that is trying to maintain physical distance as much as possible. So that part is consistent right through. So if you're having 5, our preference is that if you have 5 people over, or maybe a couple over into your household, they maintain physical distance. So that, and then if you're in the same household, you can gather outdoors with up to 10 individuals. I think it would be more in again, maintaining physical distance, very key. But what we have also added in is what you are trying to talk about. We don't want you just shaking hands with someone. No, we want you to maintain the physical distance. But if there are 1 or 2 people that are really key to helping support, or you want to extend your household to include, it's almost like you're growing your household, adopting a couple of key people that you will see on a regular basis that will be providing ongoing support in your life. Those are the people that we are saying, yes, use that physical contact like you would your household members. So there is a bit of distinction, so I'm glad you asked to try to clarify.
Okay, thank you for that. I'm not sure if I should address this next question to either you, Dr. Morrison, or the Premier, but so you talked about a little bit more clarity and an update on the Renew Together plan that's going to be posted online. Will this contain any more information about phase 4, which had the least amount of detail, about when borders might be reopened to a degree to some people, whether there'll be a date for gatherings larger than 15? Will some of these details be in the update to this plan?
Stu, I'll start. I would not expect those kind of details to be in regarding phase 4 to be in the update today. But I think what we said right from the beginning, and I think we see it today, that we have committed to updating this plan, and at a future edition of the update, some of those details will be made available. And this is consistent with what other provinces are doing and updating their plans and putting different versions out as we go forward and as we learn more. So I don't know, Premier.
Well, the only thing that I would add is that I think it also takes into consideration where we're at, as Dr. Morrison has continually stated. It does remain important for us to be vigilant at our borders, as we have been, and that will continue. And it's part of the process of what we've been talking about for a while is we have to learn to live with COVID and begin the process to explore what that looks like. So we're not ready to talk about phase 3 or 4 essentially yet, but we are looking at the phase 1 component and saying, because of the situation we're in, we can explore this a little bit more broadly than we would have thought maybe 2.5 weeks ago. But it's still a very cautious, a very careful, and very meticulous approach, and it's designed so that we can pull back quickly if we have to.
Laurent Lavoie.
Bonjour, Dr Morrison. Que de bonnes nouvelles aujourd'hui. J'aurais juste voulu, comme Stu, que vous puissiez juste réexpliquer en français quelle est la règle exactement. Est-ce que c'est 5 personnes maximum, ou est-ce que si on est une famille de 4 personnes, on peut inviter 5 autres personnes et donc on est 9 tous ensemble? Est-ce que vous pouvez juste réexpliquer ça en français, s'il vous plaît?
Bonjour Laurent, je vais essayer d'expliquer. Alors, dès aujourd'hui, nous pourrons recevoir 5 individus de différents domiciles. Alors, la famille de 6 personnes pour moi, et puis on peut avoir peut-être 3 autres qui viennent chez nous, en gardant en respectant la distance physique quand même.
Ok, et ma question suivante, toujours pour vous, sur cette drogue qu'on a trouvée dans les rues de l'île du Prince-Édouard, est-ce que vous confirmez qu'il y a eu 3 surdoses de fentanyl à l'île du Prince-Édouard en une seule journée et que c'est pour ça que vous lancez une alerte sanitaire sur ce sujet?
Oui, et puis c'est peut-être un peu plus qu'une journée, mais moins de 2 jours. On a eu 2 confirmés, 1 suspect. Et puis, c'est pour cette raison qu'on a fait la décision de juste faire, je ne sais pas comment dire ça en français, mais un alert pour les gens. Et puis, on entre dans les fins de semaine et je pense que c'est important qu'on fait un peu plus d'attention si vous faites la drogue.
Merci.
OK, merci.
François, Radio-Canada.
Good afternoon to you all. Une question en français pour Dr. Morrison, un peu dans la même veine que les questions précédentes. J'aimerais que vous précisiez, pour que je comprenne bien, ce que vous annoncez aujourd'hui, dans le fond, c'est ce que vous auriez fait à la phase 2, donc des rassemblements de 5 personnes et plus dans la maison, 10 personnes à l'extérieur, et aussi des contacts avec des personnes qui nous donnent du soutien dans notre vie, c'est ça?
Oui, c'est exactement ça, sauf que les contacts soient limités. C'est peut-être 1 ou 2 personnes avec qui vous avez peut-être besoin, ou c'est vraiment vous agrandisse ton famille un peu. Et puis, pour donner le contact avec une membre de famille, ta mère, ton frère, qui n'habite pas avec vous, mais qui est quand même important et lié à votre famille, le household, domicile.
Et un suivi à ça, si je peux me permettre, Dr. Morrison, qu'est-ce qui s'est passé depuis mercredi pour que vous annonciez cette décision-là aujourd'hui? À quoi vous avez pensé? Comment s'est faite votre réflexion pour dire, à partir d'aujourd'hui, on peut aller plus rapidement que prévu?
Alors, c'est... oui, excuse, c'est François. Oh, Julien, je m'excuse, François. C'est maintenant, tout le monde qui est rétabli. On sait que c'est depuis 2-3 semaines qu'on a commencé avec quand le plan a été développé. Et puis maintenant, on a eu seulement un cas nouveau dans ce bout de temps. On a des contrôles aux frontières qui restent en place. On continue à faire les tests. Et alors, on pense que c'est aussi difficile pour les familles ici à l'île du Prince-Édouard et les individus. Alors, c'est tous les facteurs. On a eu beaucoup de discussions depuis les 2 jours qui passent. Regardant l'épidémiologie, les autres facteurs, on sait l'impact de ces mesures pour les familles. Alors, on pense qu'on peut faire ces décisions aujourd'hui et de faire avant le fin de semaine pour les mères.
Merci beaucoup. Bonne fête des mères à vous.
Merci beaucoup.
Merci very much, Francois, and thank you to everybody. Once again, I just say enjoy the weekend and encourage Islanders to continue to be responsible and accountable. It's played a pivotal role in getting us to where we are, and it will continue to play a pivotal role in getting us to where we need to be. So, thank you very much, and happy Mother's Day.